ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतम हृदयारविंदे ओम भवानी सहितं नमामि. Let me share. Topic is study on leprosy. Leprosy is a chronic inflammatory condition of the infection of the skin by Mycobacterium leprae. It is of several types. Main types are lepromatous leprosy and tuberculosis leprosy. Is a patient with the leprosy. General question: leprosy is a chronic infectious disease of humans caused by the bacteria Mycobacterium leprae. For many years, it was considered a mysterious disorder associated with some type of curse, and persons with the disease were isolated and ostracised. Today, there is effective treatment and the disease can be cured. There is no longer any justification for isolating persons with leprosy. Subdivision of leprosy are borderline lepromatous leprosy, borderline tuberculosis leprosy, interdeterminate leprosy, lepromatous leprosy, mid-borderline leprosy, and tuberculosis leprosy. The disease can affect the skin and mucous membrane and eyes and some of the nerves that are located outside the central nervous system, that is peripheral nerves. These are primarily the nerves of the hands, feet, and eyes, and some of the nerves in the skin. In severe, untreated cases, loss of sensation, muscle paralysis of hands and feet, disfigurement, and blindness may occur. Leprosy has traditionally been classified into two major types, tuberculosis and lepromatous. Patients with tuberculosis leprosy have limited disease and relatively few bacteria in the skin and nerves, while lepromatous patients have widespread disease and large number of bacteria. Tuberculosis leprosy is characterized by a few flat or slightly raised skin lesions of various sizes that are typically pale or slightly red, dry, hairless, and numb to touch. It is anesthetic. Whereas lepromatous leprosy is at the other end of the spectrum with a much more generalized disease, diffuse involvement of the skin, thickening of many peripheral nerves, and at times involvement of other organs such as eyes, nose, testicles, and bone. There are also intermediate subtypes between these two extremes that are commonly known as borderline leprosy. The intermediate subtypes are borderline tuberculosis, mid-borderline, and borderline lepromatous leprosy. The intermediate subtypes are borderline tuberculosis, mid-borderline, and borderline lepromatous leprosy. Borderline leprosy and the subtypes are characterized by more extensive disease than polar tuberculosis with more numerous skin lesions and more nerves involvement, but not as widespread disease as in leprosy. Indeterminate leprosy reform refers as very early form of leprosy that consists of a single skin lesion with slightly diminished sensation to touch. It will usually progress to one of the major subtypes of leprosy. Signs and symptoms. The earliest symptoms are usually skin lesions that are typically flat, pale, that is hypopigmented, or reddish erythematous spots in the skin with slightly decreased sensitivity to touch or pain. These lesions typically do not present with other symptoms such as burning or pain. There may be some hair loss in the affected areas. As the skin lesions progress, they may become raised and in some cases, nodules may form. The symptoms of nerve involvement include diminishment sensation of or feeling in the affected areas, anesthesia, and sometimes burning and tingling sensations, with paresthesia. In more advanced cases, there may be weakness, paralysis, and atrophy of muscle in the hands or feet. This you see a patient of leprosy. You can see the hands, muscle wasting is there, and the reabsorption of hand fingers are there. The other patient where chronic non ulcers are seen in the leg. The histology of leprosy. You can see one chronic inflammatory condition. The patient with leprosy, you can see muscle wasting and the reabsorption of the fingers. Here also fingers are lost. There is reabsorption of fingers has occurred in this patient. Another patient with a leg having a reabsorption of fingers. This is a chronic inflammatory condition of skin. Here you see the altered pigmentation, decreased hyperpigmented areas with numbness or anesthesia. Here also, in the back there are hypopigmented areas with the anesthesia. If you take the history carefully, then patient says paresthesia or anesthesia in these areas. You can see the epidemiology and incidence of the Hansen's disease worldwide. The leprosy, the face you can see Mycobacterium leprae infection. Skins, there is hyperpigmented areas. You can see in the face there are inflammatory lesions in the cheek of this patient. You can see in the back of this patient there are hyperpigmented areas with anesthesia. In the hand there is a muscle wasting and reabsorption of fingers. You can see there is inflammation of the mucous membrane also. You can see the altered coloration is scalp. Hyper or hyperpigmented areas with anesthesia. You can see skin lesions. Here you see there are some areas in the back where hyperpigmented, and if you take the history carefully, there will be anesthesia or paresthesia in these areas. Here also in the back of the neck, there are areas of hyperpigmentation. You can see here muscle paralysis and hyperpigmented areas are seen to drop is seen. Here reabsorption of the fingers is occurred in a patient of leprosy. You can see here the hands, the fingers are reabsorbed. These are chronic inflammatory signs, plasma cells, giant cells, and inflammatory cells. Macrophages are seen in the area of inflammation. There are also granulomas you can see in the skin. Here you see in this patient, the fingers are reabsorbed and there is muscle wasting the muscles of the hand. You can see areas of inflammation. In this patient, you can see the fingers are rapsod or fallen, and there is a wasting, muscle wasting. In this patient, the muscles are thin, and there is a fingers are rapsod because of chronic ulcers. Here, the features of chronic inflammation are seen. The histopathology slide. Here also. In this patient, you can see the fingers are shortened, or rapsod. The muscle wasting also seen. Hypothenar and thenar muscles are wasted. Here, features of chronic inflammation. Is also a patient leprosy. The histopathology slide. Also shows chronic inflammatory signs. You can see in this patient hyperpigmented area in the hand. If you take the history carefully, there will be anesthesia or paresthesia in these areas. You can see in this patient there is a hand drop, muscle wasting of the hands, and fingers are rapid. In this patient also you can see the muscle wasting is there and fingers are rapid. You can see in this patient the muscle wasting is there. Fingers are deformed. In this patient, you can see the fingers, they are reabsorbed. And the muscle wasting is also seen in the muscles of the hand. In this patient, you can see in the back, there is hyperpigmented areas. If you take the history, you may say that there are paresthesia or anesthesia is there in these areas. You can see this active lesion in the skin. There is a raised areas on the skin with the altered hyperpigmented area. In this patient in the shoulder, you can see areas of hyperpigmentation and areas of anesthesia. So today we have discussed the conditions of leprosy types and clinical features. Leprosy is hard to treat. Now the medicine is there. Modern medicine has better treatment module for leprosy. Where medicines like Dapsone and other drugs are effective, and it need not be always isolated. And in Ayurveda we have Kushtagna Aushadis, Gandhakarasayana, Samanikya, and Hiranyagarbha Vajrayishta, and Sarivadasa, Chandanasa, etc. However, integrative approach has to be followed, and modern medicine has to be started compulsorily to control leprosy. Thank you for patience.